Hi, good evening, everyone. Namaskar. I'm Dr. Bishnu Panigrahi speaking from Fortis Healthcare. I'm the group head for medical strategy and operations. It's a pleasure to speak with you all. And as we know that we are in the midst of the monsoon season rather. So, and although it has been very patchy in a way that some areas have got good monsoon, some are still struggling. But it has its effects on the lungs. And keeping that in mind, we have a panel of five of our senior pulmonologists from across the network, from various parts of the country. Uh, so the topic is actually, can your lungs feel the weather? So today I'd like to just introduce our panelist. Uh, Dr. Prashant Saxena is the Principal Director and Head of Pulmonology at Fortis Hospital, Vasant in Delhi NCR. We have Dr. Srivastha Lokeshwaram, Director of Pulmonology from Fortis Hospital, Banakatta Road in Bangalore. We have Dr. Prashant Chache, Consultant Pulmonologist from Fortis Hospital, Nandani Hospital at Vashi. Two of the other pulmonologists, Dr. Sushil Gupta and Dr. Sharath, will be joining later. They have just caught up with some patients. So as soon as they come, we'll join them in. So with that, I'd like to start off with Prashant. So thanks to everyone for joining in during this busy time of your day. Uh, we often hear people say that their breathing problems get worse when the weather changes. Can changing weather trigger or worsen lung conditions?
Yeah, I think it's a very valid point, and I the answer is yes. The changing weather can trigger or worsen the breathing problems. Sudden temperature shifts, cold, dry air, hot, humid air, or poor air quality all can provoke attacks. And why it happens is because the cold, dry air irritates and narrows your airways, while the hot and humid air can make the breathing feel heavier and can worsen your airway inflammation. In fact, rapid changes in the temperature or barometric pressure also can make the people symptomatic. The usual symptoms are, coughing, wheezing, chest tightness, shortness of breath, sometimes even chest pain can happen because of this exposure. The usual culprits are the changing pollens, the changing dust pattern, the changing pollution levels, and the smoke. For example, during the winters, we see a lot of parali and all these things, and these all vary during the season and weather changes. And who gets it? The people who have asthma, COPD, lung fibrosis patients, patients who have allergic rhinitis or bronchitis, or people who have a reduced lung function. They tend to have more vulnerability towards the development of weather related symptoms and flares. Sometimes even the healthy individuals, if exposed to a lot of pollution or weather change or adverse climate, can have the lung symptoms or pulmonary symptoms.
Okay, thank you, Prashant. Dr. Srivast, coming to you
Yes.
is that how do humidity, dampness, and mold affect lung health?
So it's generally seen that humidity alone, of course, worsens lung conditions, but it creates an environment where, molds, certain microbes, as well as dust mites thrive. So most of the time, when we're talking about humidity, the relative humidity of our immediate atmosphere is normally supposed to be between 40 to 60%. Anything that crosses 60% and above of humidity causes an environment where mold grows. And mold is seen to be consistently associated with the entire spectrum of lung disease, be it COPD, asthma, ILD, and exacerbate any of these. But most importantly, we have to understand mold induced lung diseases. There's a certain subset of asthma who have a propensity to get exacerbated when exposed to molds, especially aspergillus, and that is called asthma with fungal sensitization. And these can progress to significant damage to their breathing tubes and leading to bronchiectasis as well. or as we call allergic bronchopulmonary aspergillosis. Second, only we should also understand that apart from the so-called famous pigeon feather associated or pigeon droppings associated hypersensitivity pneumonitis, we also have significant amount of mold exposure leading to hypersensitivity pneumonitis, and we have studies showing that the air conditions as well as other type of conditioners where the filters are not changed frequently leads to significant mold growth and contributes to worsening of these lung diseases. Many of these hypersensitivity pneumonitis, if you don't manage appropriately, timely, and avoid the exposure to subsequent of these allergens, leads to progression of the lung scarring, and the patient might even be sitting on oxygen, ultimately requiring a lung transplant. That said, in today's era, when we have significant amount of the population who are receiving medications to immunosuppress themselves, like you have patients with bone marrow transplant, lung transplants, and other types of leukemia who have undergone transplants, sitting in a hot, humid environment with high, circulating amounts of fungal spores can lead to a lot of invasive fungal infections themselves. So, fungus as such can not only lead to a benign allergic exacerbation of your asthma, but also lead to life-threatening infections like, aspergillus, uh, entire span of, chronic aspergilloma moving on to invasive aspergillosis. So it becomes very imperative to stress to people who are hearing us to tell them that ventilation should be adequate. Make sure your rooms are not having significant seepage of water, and attend to these old molds, especially in old houses, by repainting the surfaces and making sure there is no chronic exposure, and keeping your underlying lung diseases well controlled, like your asthma and other things, so that they don't get exacerbated, especially during the monsoon season when the humidity levels are high.
Dr. Srivas, I just want to go a little deeper here because there's a lot of people who will be the target audience who will be common man listening to this because humidity, dampness, mold, this is a common thing that we see in the countryside also. So, what is your take home message to them that they should be sort of aware of and the do's and don'ts?
So the most important thing is that fungal spores can, even though they seem very benign in your room, just a few black spots on the wall, can significantly affect your lung health, is what we are trying to say. And it becomes very important to get rid of these visible molds, and making sure that if you're in an occupation where there is constant exposure to these kind of molds, to wear protective gear, being it a common man. And also, like I told you, it is important that you condition your air within your vicinity. So if you have access to an air condition, fantastic, keep the humidity between 40 to 60%. But despite of which, making sure that the filters as well as the air conditions have been serviced frequently, so that there is no overgrowth of fungal molds within the system itself, which can be then later accentuating the situation. Also, it becomes important to keep humidifiers in places where it is necessary. And also, if there is a basement area where the ventilation is very poor, we have to make sure that there is sufficient ventilation created in basements to make sure that many of our office spaces in the basements are not infested with these fungal spores. The
Okay.
second important point, apart from controlling the etiology itself, is to make sure that the disease that the fungal spores can, accentuate are well controlled. Especially patients who have asthma, ILD, need to be taking their medications regularly so that they do not have increased sensitivity or susceptibility to these fungal spores. People who are immunosuppressants must make sure they're monitoring their immunosuppressant levels. For example, your lung transplant patient who's on tacrolimus, you need to monitor their, window of tacrolimus levels so that they are not significantly immunosuppressed predisposing them to get invasive infections in the future.
Okay, thank you. Coming to Prashant from Vashi, Navi Mumbai, how do humidity and pollution together affect our lungs?
So the discussion so far has been, very clear, and I think some of the points that we may speak may be overlapping, and
Sure.
the overlapping points would just emphasize that yes, they are important points. Now, coming to this humidity and pollution together, I think they are not independent; they amplify each other. So if in a simple language, you said our audience is the common man. So if humidity is the vehicle, then pollution is the passenger. Okay, so together they travel deeper into the lung tissue and cause problems. So humidity increases the air density. We know that whenever the air density is increased, the pollutants stay down. They're suspended longer near the ground level instead of rising, such as the PM 2.5 and PM 10 particles. Okay, so humidity also swells the pollutants because of the hygroscopic nature. So the sulfates, the nitrates, these are some of the things which are there, which can increase the size of the particles as well. So in combination, what it does, it increases inflammation, it causes bronchitis, it increases mucus secretions, it can also cause bronchoconstriction. So this is the combination of the humidity and the pollution together. Pollution as a combo. The pollution, the humidity helps the pollutants to affect the lung more adversely. Okay, and I think this is the important point. I would say that both go hand in hand, and therefore, as has been highlighted earlier, I think if it is possible to control humidity situations, particularly when you're at home living, and if suppose you're living close to a street, the pollutant levels are very high. So then, if possible, you have to take the pollutant or the humidity reducing measures.
Thank you. Dr. Sushil Gupta, am I audible? I think we're having some. Dr. Sushil Gupta? Okay, I come to Dr. Sharath from Hyderabad, Bangalore Clinicals. Dr. Sharath, he's a pulmonologist from a Clinicals Hospital at LB Nagar, Hyderabad. Dr. Sharath, can changing weather affect our sleep and breathing?
Good evening, all the panelists. Sure, sir. Yes, it can affect our sleep and breathing. See, look, the respiratory system will always be in direct interface with the outer environment of the air we breathe. So, any changes in temperature, any changes in humidity, any changes in air quality, or barometric pressure, like previous sir has spoken, all these have an effect physiologically, and they do take a toll. Like, for example, if it is a cold air, in instances in the during the winter period and the cold air, the dry air causes the cooling of the airways, and then thereby it will change due to the osmotic changes in the airway surface liquid, and then it will lead to mast cell degranulation, and then bronchoconstriction will happen. And we see more of a nocturnal symptoms in these patients, because more during the winter and monsoon seasons. So patients who are already having sleep related problems, and they get these nocturnal symptoms because of the weather changes, and they do affect the sleep patterns in patients who are already having a fragmented sleep. So it is very important to keep a check on the humidity levels, on the air quality index, and you know and keep your I mean, if you're living in a high humidity region, it again favors the mold growth, dust mites, and bacterial or fungal infections we can see in the on the higher side during the monsoon seasons, whereas it is if it is in the winter season, more of a dry weather will be there, and there will be more of aerosolization of all the viral infections or SARS or rhinoviruses, RSVs, and all that. So they trigger bronchospasm in these patients. So people who are already having the sleep-related disturbances due to this nocturnal hypoxia, maybe, or increase in the nocturnal bronchospasm-related bronchoconstriction. So they will have ultimately effect on this sleep and their breathing pattern. Yes.
Thank you. Dr. Prashant, what precautions should people with asthma and COPD take?
Yeah, so I think another important point, I think most of us are discussing these precautions which one should take on a daily basis. One of the factors which I feel is frequently neglected is that patients who have lung ailments like asthma, COPD, they don't check the weather and the air quality forecasts. So ideally, when you are moving out of your house or you are in a weather which is not suitable for you, you should check the weather. And if possible, you can avoid it, then you should. Otherwise, if you are about to face an environment which is highly polluted or the pollen is a lot in the environment, then mask should be worn. N95 mask is the preferred mask, and you should always wear when if you are already having a pre-existing ailment. Number two, if you are facing a cold air or you are having air which is humid, then you can easily cover your face or the mouth uh, and the nose with your handkerchiefs. It sometimes helps a lot. You don't have to wear the mask all the time. And the warning signs in a patient who has asthma or COPD, if they are out somewhere and they fears, there's unexplained breathlessness, there's unexplained chest pain, chest tightness, they are not able to speak properly, the lips are turning blue. These are the warning signs, and immediately they should seek medical attention. And always before you face such season or changing season, you should have your rescue plan ready or your action plan ready. That if I face a problem, I should take the following medicines and they should be handy, and you should have the rescue inhaler always in your pocket all the time. So with the simple precautions and obviously the environment cleaning, clean your environment, avoid burning the waste, the garbages, all these indoor and outdoor pollution one must control.
Okay, thank you. Dr. Srivas, that a common thing which many of us ignore when I'm talking about a common man is that how can we tell a seasonal cough from something more serious?
Yes. So, see, cough is a protective reflex, no doubt. So it helps to, throw out the material which the lung doesn't need inside and which the lung considers to be intrinsically very irritant to it. So cough is okay if a person continues to have cough for at least 1 or 2 weeks. That is after a common cold or viral infection. When does cough come to our attention is when cough becomes excessive, persistent, and is disturbing the normal quality of life of a person and makes him dysfunctional. So now the cough can either be subacute, which is between about 3 to 8 weeks, and anything above 8 weeks is what we call chronic cough. Now, cough as such does not cause many problems if it follows a benign course. But if the cough is associated with certain other obvious signs like coughing out blood, coughing associated with chronic fever for many weeks, cough associated with significant loss of appetite or weight, especially in a country like India, this should ring alarm bells whether this patient is having any chronic infection like tuberculosis, other types of opportunistic infections like fungus, and so on. Also, cough can also be associated with various other symptoms like giddiness, syncope. Sometimes is misleading and drives the patient to the neurologist thinking that they've got a cerebrovascular accident or a stroke. But cough itself can lead to these kind of symptoms itself, and that we must be aware of. Another important thing that we would like to say about chronic cough, especially in patients who are smokers, who have sudden onset of change in voice, loss of appetite, loss of weight, scanty amount of bleeding, is to also search for if there is any, early stages of lung cancer within them, or it could be even in certain non-infectious diseases where the lymph glands in the central part of the chest are swollen Like we have a host of granulomatous diseases in India apart from tuberculosis, like sarcoidosis, which can also lead to chronic cough. So it is important that not only to pursue the symptom cough, but what cough is associated with becomes very important when the patient comes to us to understand what exactly is causing this. Apart from this, generally a person who is attending to a person with chronic cough would classify the patient as usually having allergies, treat them with inhalers, corticosteroids, and so on and so forth, antihistamines to try to relieve the cough. Or even we see a lot of patients finish couple of bottles of cough syrup before they even land up with us as specialists. It becomes very essential to keep our spectrum wide and understand that sometimes the most unidentified causes of cough are simple but arise from areas which are not necessarily within the lung. For example, you have gastroesophageal reflux disease. Though it is primarily a gastro problem, the patient presents to the pulmonology OPD because there is a constant aspiration of the acid into the breathing tube that leads to chronic cough. There are also patients who have postnasal drip or upper airway cough syndrome, where the running nose, comes and settles down into the throat and causes unrelenting cough, especially at night. Many a times it goes amiss that we don't look into the medications the patients are following. Some commonly used medications like for BP control, AC inhibitors and cardiac medications, beta blockers can also lead to chronic cough. But nevertheless, we must still look at the patient holistically. Many a times it goes amiss that the doctor examining the patient assumes the patient is asthmatic. But if he hears the patient clearly, there might be signs of early lung scarring. And looking at an X ray, many a times we miss these early cases of lung scarring or interstitial lung diseases, as we suggest. So it was very important in these patients that if they have chronic cough, progress to a full blown CT scan to give us better details of what exactly is happening within the lung and outside the lung of the structures that can have effect on cough.
Yeah, Dr. Srivastava, I just want to ask one thing. You mentioned about persistent coughs. I want to just dive slightly deeper because for the common man,
Yes, sir.
when should the persistent cough be a cause for concern?
So if the cough is persistent beyond 8 weeks, then the common man must importantly visit a physician or a super specialist pulmonologist to look into what exactly is driving his cough rather than keep his symptoms away. Most of the time, the common man will assume that the cough is part and parcel of a normal allergic process or something else and usually ignore it. Or they will come to you when they have other types of symptoms like chronic fatigue, muscular pain, many of the times, chest pain. That is when they will come to you. But I think any cough beyond 8 weeks requires a very systematic approach and evaluation, right from blood test all the way till X-ray and radiology and CT scan, also pulmonary function test to ascertain what we are dealing with.
Thank you. Dr. Sushil Gupta has joined. He's the Director of Pulmonology from Fortis Hospital, Ludhiana. Dr. Sushil, welcome on the panel. Uh, how do cold air and fog affect our lungs?
Sir, as we are, it depends upon the sensitivity of the person. If anybody is sensitive to cold air or the fog, they are usually get the bronchospasm. The airway gets tight and there is inflammation of the airways because the cold air it acts as an irritant and it sensitizes the various receptors at the airway level and it causes the as a reflex bronchoconstriction as well as there is increased mucus production which exacerbate any underlying lung condition, especially the bronchial asthma or any allergic lung condition. And secondly, there is increased risk of infections in the lung weather, cold weather. So it also promotes the increased risk of infections also. As far as the fog is concerned, in these days in our country, especially the where in Delhi or in Ludhiana, where there is the industrial cities, there is a lot of pollution. So actually, it is not the fog; it's the combination of smoke as well as fog, which we call it as a smoke. They are all the way more dangerous to the lungs and causes various allergic lung diseases, as well as it also promotes the increased susceptibility of the infections to the patients who are already immunocompromised or having underlying structural lung disease.
Okay, thank you. Dr. Sharath, a very important
Sure.
which comes in is actually about the vulnerability of children and adults, the elderly. So, are children and seniors, the elderlies, the more vulnerable to weather-related lung problems, or is it a myth?
No, sir. Definitely, both are equally vulnerable for different physiological reasons. So both age groups are at the ends of age spectrum. One is too young and one is too old. So they both have altered immune responses and the different respiratory reserves. So coming to the children, they'll have a smaller caliber airways already, and uh, any airway insult which is causing the same degree of mucosal edema or any infection causing the airway inflammation, it causes much larger percentage reduction in the normal working lumen of their airways, and that is why we often see bronchiolitis and these groups barking coughs. They peak in the winter seasons in children, and also their immunity. They have a very immature or less immune system compared to the adults. So they have no prior exposure to all these viral infections or other uh, agents. So these seasonal viruses hit them harder, and they cause serious respiratory this thing distress. Coming to the whereas on the other contrast, if we look at the seniors, I mean in the senior citizens more than 60-65 year old, they already have reduced respiratory reserves, be it loss of their elastic recoil of their lungs, or reduced mucociliary clearance, or maybe respiratory muscle weakness or fatigue. So minimal VQ mismatches will cause uh, they have this changes, respiratory distress changes. They'll be precipitated more in these patients, especially in patients like comorbid, who has comorbid conditions, be it respiratory or non-respiratory. Coming to the respiratory, if they already are a COPD patient, bronchial asthma patient, ILD patients, or bronchiectasis patients, or if you come to the other comorbid conditions like chronic congestive heart failures, chronic kidney disease, or uncontrolled diabetes. So a weather-driven, or changes, or seasonal infection, flu infections, they take a toll on them. So as they say, a weather-driven, just common cold in a 30-year-old is not. I mean, it would be just a common cold in a 30-year-old person, whereas the same thing with a comorbid patient in his 60s will precipitate as acute exacerbation of COPD or maybe a pneumonia also. And this is all because of the what do you call, the blunted immune system for the antiviral response, or due to exaggerated inflammation, it can be happening. And in such patients, also even in OSA patients, as I already spoke earlier, so who has already have a fragmented sleep, and then nocturnal, these cold induced bronchoconstriction or hypoxia, or heart tachypneas, the they even impact their sleep. And so the key things to look in geriatric patients would be in winter seasons, like pneumonias, acute exacerbation of COPDs, influenza viruses, and they should keep a watchful mind on it. And then precautionary to measures to would be to get vaccinated, and keep the hygiene, use of masks, and uh, try to keep a watch on their air quality index or the weather conditions outside and take necessary precautions would be appropriate for them, along with
Yeah.
vaccination.
Thank you. Dr. Prashant, just now we heard Dr. Gupta talking about weather. So, is recurring weather-related breathlessness a sign of an underlying condition?
So I think, see, that's very important. These recurring breathlessness. Often, what happens is individuals who have allergies, they will attribute it. Just there's a change of weather. I have a ear cough and cold. In India, it's very common to just go and take an over-the-counter medication and self-medicate. Now the question is, does it mean anything? Suppose can healthy individuals get a small cold or a cough when there's a weather change? The answer is yes. But if an individual is getting that on a recurrent basis, that say, for example, every weather change, these individuals have a problem, they are visiting their GPs, and the cough and the cold stays for a few weeks, I think that is what is worrisome. If these cough cold symptoms are present with a shortness of breath, with a wheeze, with a chest tightness, then that becomes something that one should pay attention to more. And in this situation, what are the possibilities? The possibilities are what we call as a seasonal asthma. That's one possibility. Somebody could have an allergic rhinitis or a seasonal allergic rhinitis, which is only weather based. So a change in weather, the individual gets exposed to a particular organism, an allergen, and the patient, individual starts to get the symptoms. So if the symptoms are recurrent, you have to think of allergic rhinitis. You have to think about seasonal asthma. You have to also, it could also be COPD. If somebody is smoking or has an exposure to chula fumes, people have worked with chula fumes in the past, have migrated to the city, and now they start getting recurrent symptoms. Then you have to think about COPD also. Can this be ILD also? Yes, in early interstitial lung disease, what happens is these people typically have enough reserve capacity, the symptoms are minimal. And what happens is a normally occurring cold or a bronchitis is affecting individuals with an underlying disease more than a healthy person. So the message I want to give to the audience is that if you are getting recurrent symptoms with a weather change, just don't attribute it to a weather change. If it is severe, it lasts for a week or two, and you need to go to your GP on a frequent basis, you must think and rule out whether there's any underlying lung issue. And I think this can be very simply done. We've got simple tests like a spirometry, an X-ray chest if required. I think that's what one has to pay attention to.
Thank you.
One more thing I would like to say is I'd like to highlight is, when you mention humidity, okay, in humidity, say for example in Mumbai is very humid and hot. So in hot and humid weather, the dust mite thrives. Okay, and in this situation, if these individuals are getting a wheezy and a cold or a sinusitis which is not getting settled, then one individual has to think. One has to be evaluated whether it is an allergic bronchopulmonary aspergillosis. Sometimes you get aspergillosis associated sinusitis also. So humidity also promotes fungal spores, and these fungal spores can also worsen or can affect individuals with asthma who are sensitized for the fungus.
Thank you. Prashant, coming to you, because over the last week or 10 days, we've been seeing cases of H1N1 coming up, and more in Delhi NCR than in other regions of Fortis network. So just if you could just sort of, in brief, outline to the public who's listening to this podcast, what is H1N1 that we keep reading and hearing on the TV, and what are the precautions they should take?
So H1N1, or as popularly known as swine flu, it's a type of influenza, and influenza illness is caused by viruses, and one of the viruses is known as the swine flu virus. And H and N denote the antigens which are found on the virus cover. So H1N1 signifies a type of virus. Now this virus usually is transmitted through droplet infections and close contact. and it can cause mild illness from common cold, sore throat, down to high grade fever, shortness of breath, and can cause gross hemodynamic compromise and even admission to the ICUs. So the severity can be mild to very severe. What we have to remember, what as public we can do, one of the best preventive strategies against this virus is maintaining a hand hygiene, using hand sanitizers even when you are touching the surfaces or you are traveling on the metros or the buses. Number two, masks. We frequently ignore masks during this season, and as I told you, it's a droplet infection, and one should always wear mask if you are in a metros or buses, you're using public transport in a crowded place. N95 mask is the only one which can protect you. So please don't shy away from using this mask. Number two, always before the season, which is end of August or October or September, one must get vaccinated, especially in endemic regions like Delhi NCR, against the flu viruses. So, and obviously, health hygiene, maintenance of adequate hydration, diet planning, a lot of fruits, all this helps a lot. But don't get scared. If you are following these simple steps, you can avoid the influenza virus and the seasonal influenza attacks.
Thank you. But Sushil, just coming to you because
Yes,
as
sir.
the monsoon goes off, then we'll see autumn and then winter coming in. And North India is always in the throes of the pollution that comes in with the burning of the fields that all of us are aware of. So, you being in Ludhiana, uh, what is the advice that you will give? Because the precautions that public at large can take.
So basically, it's the pollution which increases, especially when the winter comes, because of the air gets dense and it comes in the respiratory range. So we can breathe in the lot of pollution. So the major issue is that we all know about the pollution. We all do take care of the outdoor pollution, but most of us doesn't talk about the indoor pollution, which is going happening because of constructions and various things, paints and polish, which are doing due to the festival seasons and various artificial things. And so we can need to prevent ourselves, our patients, especially with the chest diseases or with low immunity, with these all both indoor as well as the outdoor pollution. So whenever who is sensitive, whenever he or she goes outside, he or she can wear the mask. He or she can go to the vehicle with closed windows and with air purifiers in the car system. And we should avoid direct contact with the chemicals and the burning of stubbles, going into the farms where there is a lot of pollution due to burning of stubbles of the these farms. So we need to prevent all these things. And second most important thing, which Dr. Prashant has already highlighted, at this time there is lot of viral infections, especially the influenza vaccine infections. So we need to protect ourselves from the influenza by getting the influenza shot also. And whenever there is any doubt, whenever there is having any problem which is not getting settling down, one should get consult with the pulmonologist or any other good specialist. Thank you, sir.
Thank you. I'd like to thank all the panelists. And before we sort of close this session, I'd like to say that we can pick what we want to eat, what we want to wear, but we have to breathe the air that is there in that place that we are residing in and working in. So I'd like to just pass on one-line messages to for all the panelists. What is the message that you would like to give the public at large uh, during this monsoon season and as monsoon ends over to winter? So some take-home messages that they can take. One by one, over to you.
So I would like to say
Prashant?
that breath is life, and protect your breath and your lungs.
Yes. Sushil?
Sir, I would like to say that one should get vaccinated. We should not get shy away from the vaccines, especially the influenza vaccine, and we should protect ourselves with the direct contact of the pollutants. And thirdly, we should plant more and more trees so that we can make our air healthy. And it's not beneficial for the old and sick patients, it's healthy for everyone. And we should plant every day maximum trees or the plants day by day. Thank you, sir.
Thank you. Srivastava,
I would like to say, sir, no doubt vaccine is very key. So most of the elderly as well as young children should get vaccinated against influenza as well as pneumococcal. And apart from that, to keep your houses well ventilated and humidified to the correct tune of 40 to 60%. And most importantly, keep your underlying chronic lung diseases well controlled, like using constantly inhalers and preventive medications so that you don't land up with severe disease or exacerbations.
thank you. Dr. Bharat,
Yes, sir.
Dr.
Yeah, it will be the overlap of what the panelists have told. So basically, improve your humidified air condition, the air you breathe. So take care of it. If required, use a air humidifier or air purifier with HEPA filters or anything. If you have a more air quality index at your region, and keep yourself. Your immune in check by taking regular vaccinations if you are elderly or if you are in a pediatric age group population at your home, and people who are with comorbid conditions, they need to take necessary precautions during this monsoon and winter seasons. So I think basic, if patients can do just these few things like taking care of the humidified air and reducing their exposure to dust or smoke or rather everything, and maintain their immunity status, I think we can more than cut down 50% of seasonal OPDs visits or asthma exacerbations or COPD exacerbations.
Prashant,
Yes, sir.
any one-liner you have?
Yes, yeah. So I think I think the message which I normally speak to my patients, the patients who are I do some community talks as well, and the elderly patients, the COPD, the ILD patients. What preventive stuff we can do during this increased humidity and these weather conditions? I think the important thing is, in Mumbai, you step out and then you have a lot. You can have a lot of pollution. The best is to assess the situation. Best is to travel out of home when the sun is up and about. Unless you're forced to leave. If the sun is there, then the high temperature allows all the pollutants to rise, and it causes less problem. That's number one. Another thing is to use masks. Now the problem is, if I tell my patients with an ILD or a COPD to use a mask, they say, "Doctor साहब, वैसे भी सांस लेने आती नहीं, आप mask पहनने बोल रहे हो." So what you do is, okay, the deal is, if it's a very if the pollution levels are very high, then you can use an N95 mask. But now you have N95 mask with a ventilation port, so that makes it easier for them to breathe. So we are not compromising on the mask, but then what happens is, in COVID, everybody was thinking only about the N95 mask, and the ventilation port was not allowed because it could allow spread of infection. But the port ones are very good for my COPD and ILD patients. If there is just a simple asthma allergy patient who gets affected with the pollution, they can wear a simple surgical mask which is disposable and that can go off. What about traveling? How about, for example, people want to go for a walk? There's pollution there, there's humidity there. I say a simple solution, which was proposed to me by my patient, is that there's a big mall and they go and walk in the mall, with the belief that yes, the air conditions and the filters would be at the highest level. So that's what one thing one can do. The other thing is to breathe through the nose. I think if somebody is breathless, if somebody is trying to breathe heavily, then this individual should walk slowly if they are having some breathlessness on exertion, and try to use the nose, because our nose is our normal humidity filter, normal filter. So try to avoid oral breathing. And another important message is, if there are recurrent symptoms, like a cold, cough, and a visit to a GP that an individual just does routinely every few months or a few times a year, I think that should not be ignored. And particularly if that's associated wheezing and prolonged medication use, it could be allergies, or it could be asthma, or it could be bronchitis, and in rare conditions could be interstitial lung disease.
Uh, Thank you to all the panelists. It was a wonderful session. And on behalf of Fortis Healthcare, I'd like to thank the audience who's hearing this, seeing this, because we are very clear from our organization is that health is wealth. And we as an organization want to see that people stay healthy. And I think so sessions like this send out a huge message that how do you spread good things that they should be doing and avoiding things that they should avoid. And a lot of good inputs came in. Please inculcate these inputs, and wishing you everyone thank you.
Thank you.
Thank you, sir.
Thank you, sir.